Hello, my name is Mike.
And I'm Magdalena.
My name is Carrie.
And we did Chapter 49 in Neurological Disorders.
The basic anatomy of the nervous system is comprised of white matter, which is myelinated axons, gray matter, which is referred to as the cortex, and that contains nerve cell bodies, dendrites, and axon terminals, as well as unmyelinated axons. The brain is encased by the skull and three membranes, the dura mater, arachnoid membrane, and the pia mater, all surrounded in cerebrospinal fluid. There are 33 vertebrae that form the spinal column that protect the spinal cord. Nerve cells, or neurons, are an important part of communication in the body. A neuron is comprised of a nucleus, an axon, and dendrites. The dendrites bring information to the cell, and the axon transmits information out of the cells to the destination or organs. The central nervous system is comprised of the brain and spinal cord. There are two systems, the central nervous system and the peripheral nervous system. The peripheral nervous system has sensory input and motor output that is divided further into the somatic or voluntary control, skeletal muscles, and the autonomic, the unconscious regulation of bodily functions like respiratory rate and heart rate. The sympathetic nervous system activates the fight or flight response, and the parasympathetic activates the rest and digest response. Some common neurological disorders are neural tube disorders. One of the more common types is spina bifida, which is Latin for divided spine. This occurs when the embryonic structure that forms the brain and spinal cord is malformed in utero. Folic acid is recommended as a prenatal supplement to decrease this incidence. The next is cerebral palsy, which is a non-progressive disorder that affects motor neurons, creating spastic hypertonic muscles with dramatic deep-tended reflexes. The different kinds are dyskinetic or ectoid, which is worm-like movements, or ataxic, which is a wide gait and difficulty with fine motor skills. And then there's mixed type, which is ectoid or ataxic and spasticity together. The next common disorder is inflammatory disorders like bacterial meningitis, group B strep, and botulism. Following that are inflammatory disorders like carpal tunnel, facial palsy, which is the paralysis of the seventh cranial nerve. Then you have proximal disorders, which are recurrent seizures. Following that is ataxic disorders, which are the failure of muscle coordination and improper muscle action.
The next section is assessments. The assessment begins with taking a thorough history. So this includes asking information about the chief complaint. So examples of this with a child with signs and symptoms of a neurological disorder may include seizure, loss of consciousness, delay in certain developmental milestones, or clumsiness with these tasks, headaches, and other symptoms. Then we move to past medical history. So we would want to find information about if mom had an infection during pregnancy, if there was a difficult birth, difficulty initiating respirations at birth, or any head injuries from a fall or injury. And then the last piece is the family medical history. So we want to ask if anyone in the family has had a history also of headaches, migraines, seizures, or other neurological problems. Next slide. Next we go in to do a complete neurological exam, which can take up to 20 minutes, so it is difficult to keep the child's attention at this time. There are 6 main areas that need to be assessed, which I'll go into further detail in the next slides. But as I mentioned, it is difficult to keep the child's attention, so trying to make these different tests or tasks into games is very helpful. And it is important to also show approval even when they are having difficulty doing these different tasks. Next slide. So the first one is cerebral function. This includes assessing their level of consciousness, orientation, intelligence, performance, mood, and their general behavior. Many of these things can be noted just through conversation, especially their level of consciousness and orientation. And you'll want to note any type of drowsiness, lethargy, or their articulation issues if you notice any. This also includes immediate recall, recent memory, or remote memory. And just to note, a child at 4 years is able to remember 3 digits, and a child 6 years or older can remember 5 digits at a time. This also includes other sensory perception tests. So this picture here is what's called stereonosynosis, and this is the ability to recognize objects by touch. Next slide. Next is the cranial nerve function testing. So it's important to test all of these different nerves as they each have a specific function. To test these are part of our standard head to toe, but some of these include smell, vision, pupillary reaction, eye movement, hearing. You also want to have the patient smile, frown, stick out their tongue, and then shoulder elevation. Next slide. The next test of the neurological exam is the cerebellar function test. So this is for balance and coordination. So you're going to observe the child walk. It's best to do this as they're walking into the exam room so they're not necessarily know that they're being watched. You're going to have the child balance on one foot. So a child as young as 4 should be able to balance for as long as 5 seconds. And then tandem walk. So this is a picture of tandem walking where they're putting one foot in front of the other. And then you're also testing coordination by having them touch his or her nose and your finger as you move it. Next slide. Next is testing motor and sensory function. So this can be tested by looking at the different myotone and dermatome patterns. You're also assessing muscle size, strength, and tone, and you want to make sure you're comparing these bilaterally. The sensory system, when you're testing that, they should be able to distinguish light touch, pain, vibration, and hot and cold temperatures. So to test this, you're using a wisp of a cotton versus pressure or like deep pressure of your finger. You're going to use a pinprick to detect pain, and then you can use water bottles filled with different temperatures of water so that you know that they're detecting the different temperatures. Next slide. Then, as we're all familiar with, we are testing the deep tendon reflexes. This is a part of the basic physical exam, but it's also a very important aspect of the neurological exam. Next slide. And then during the physical examination, there are a number of different things that we should be monitoring for. So there's common signs and symptoms of a neurological disorder. So these would be increased head circumference, bulging fontanelles with our much smaller children, unequal size and response of pupils, and unequal globe movements. So when you're having the patient follow your finger back and forth or a light or something, their eyes may shake, and that's what you're looking for. So projectile vomiting, widening systolic and diastolic blood pressure, a decreased pulse rate and respiratory rate, an increased temperature, a headache or pain in the neck, especially with flexion, and spasticity of the muscles. Next slide. The next important part of the assessment is moving into diagnostic studies that we have to use. So if possible, you want to start with the least invasive first so that you can gain the child's cooperation and explain what they can expect physically and what sensations to expect. So the first one on here is the lumbar puncture. So you're using a needle that goes into the subarachnoid space at L4 and L5. So this is one of the most invasive procedures. So this is used to diagnose hemorrhage or infection in the central nervous system and to diagnose obstruction of flow of the CSF. The next one is a ventricular tap. This is used in infants. So the CSF can be obtained by a subdural tap into the ventricular through the anterior fontanelle. So the anterior fontanelle still has to be open. And then the fluid must be removed slowly as to not shift pressure. Otherwise, you can have some other major issues from there. The next test on here are the different x-rays. So this can be used to determine skull fractures, increased ICP, and because you can see if the skull sutures are being pulled apart or separated. You can see the cerebral angiography. So this is an x-ray of the cerebral blood vessels. So this does require an injection of contrast into the femoral or carotid artery. And then a myelography, which is an x-ray of the spinal cord after contrast, has also been introduced via lumbar puncture. The next on this list is nuclear medicine studies. So this includes a brain scan. This is using radioactive material that's injected via IV, and radioactivity levels over the skull are measured to determine if the blood-brain barrier has been breached or if it's functioning. Next is a PET scan. So this is a different type of injection or a different type of contrast or dye, and it accumulates at diseased areas of the brain. So this is really helpful to detect and identify the seizure foci so that they can figure out where that's coming from. The next is an echoencephalography test, which is an ultrasound of the head or the spinal cord. This is obviously much less invasive, and it's more commonly used in the NICU to monitor intraventricular hemorrhage and other problems. And then the other one that you may be familiar with is an EEG. This reflects the electrical patterns that summarize physical and chemical interactions within the brain. And so many times it is requested that the child be kept up really late at night so that they can sleep during this, because you cannot have movement during the test.
Okay. And then with health promotion, so whenever you're doing health promotion, you want to start as early as possible. So kind of a good thing for a provider to do is to encourage mothers or expecting mothers to start eating or taking in folate. So as Magdalena was talking about with the neural tube disorders like such as spina bifida, definitely ensuring that the mother prenatally is starting to have adequate intake of that. Also, you want to make sure mom is having routine health maintenance visits, screening for possible neural tube development problems going forward, and also to get timely immunizations to help with that. And then also to kind of prevent any risks. Definitely one thing that is very important for family members to understand are the signs and symptoms and risk factors. So as Carrie was stating, some of those risk factors are going to be increased head circumference, bulging fontanelles, vomiting, sometimes even projectile vomiting, and waking up in the morning with a headache. Also, there's going to be visual changes, so they're going to have double visions, whiten the sclera over their pupils, and limited views. So definitely when you want to educate your family members, you want to make sure they understand these, because one of the most important things to preventing a permanent damage from occurring is assessments done early and often. All right, next slide for me, please. Okay, and then going into kind of cultural considerations, definitely one thing that is very important for families or for nurses to understand is kind of how the family perceives their child's illness. Some families, especially with seizures, may believe that they're being possessed by a demon, an evil spirit, or some other entity. So kind of a nurse should take the time and talk with the families. Just make sure that the nurse is hearing what they're saying and that they're also just trying to promote and try and figure out a common ground to kind of go for. Also with neurological disorders, there's going to be a negative stigma. So just kind of these stigmas can be kind of brought on by cultural beliefs and so basically what you want to do is just destigmatize the families and just make sure that they're educated and just knowing of this disorder. And it's also nice for a nurse to kind of understand these misconceptions and understand where the knowledge gaps are to kind of just help them and educate them through this process. All right, go to the next one. And last but not least, so we're going to go kind of in the holistic care. So as previously stated, one of the biggest things is to educate the family and ensure they understand the disease, the health promotion, and just the assessment factors that kind of go into this. And that also a lack of education can worsen these stigmas. So according to Rommel Fanger et al. 2017, negative stigmas regarding neurological disorders can be associated with poor education by clinicians, leading towards patients not fully understanding their disease processes. Nurses and providers need to ensure that patients do not have these knowledge gaps when it comes to their disease process. And also, you just want to make sure you're promoting this patient's well-being, making sure they're getting their follow-up visits, that they're also taking the necessary precautions. If they're on seizure precautions, you want to make sure they're taking their medications, that they're following up and getting the necessary labs done throughout their care.